am here as the director of the RMIT Digital Health Hub. I also want to introduce Susan Feitosa, who's the RMIT Senior Partnership Manager, and she is also the co-lead on the Melbourne ecosystem for the ECH Alliance. Now, we say the Melbourne ecosystem, but in Australia right now, there is only one ecosystem. And so whilst I will talk a little bit about RMIT and what we're doing here, I see Andy's come off mute. Are you about to correct me, Andy?
I would never do that.
So I will also talk about Australia and digital innovations here in Australia, because obviously we're a very big country, and I'm going to assume many of you have not been here, though. Tip my hat to Samantha, who is also a fellow Aussie, who I can see is on the call. So RMIT is a university that's based in Australia, but we do have multiple campuses, and I'm going to come back to that in a moment. But we originally started as an institute, but we've always been focused on technology. So RMIT is our legal name now, but it actually stands for Royal Melbourne Institute of Technology. And I've got a number of slides which I'm going to move through really quickly, but I'm very happy for these to be shared if anyone wants to have a look at it for a little bit more detail, because I've provided a lot of information on these slides about particularly our areas of strength across digital health. But we are a world-class leader, and here's some boring statistics for you to be able to look at where we actually excel in our leadership. But particularly we are ranked by the World University Rankings in the top 1% of universities globally. And we have a number of areas which we are ranked very, very highly in. So you can see here we are ranked amongst the world's top 100 universities across these areas of including design and engineering. And that makes us really strong within our digital health and med tech type areas. We are also, as I said, not just based here in Melbourne, Australia. We also have campuses across the world. And in particular, you can see in the left-hand corner, our Barcelona hub. So digital health is one of the focus areas of that hub. We already have research staff based there and are undertaking research projects from our Barcelona hub. By having that hub, as well as our RMIT Vietnam campus, it means that we're allowed to participate in a lot of European calls. So, for example, the Horizon calls or the Marie Curie, and be able to partner with a lot of our European colleagues. And so some of you already know, and I'm working with you on other research projects, and many of you I'm looking forward to getting to know more. Because this hub allows us that pipeline or pathway into the European market. But also, it works the opposite direction. So we've worked with some organisations already that are looking for a pipeline back into Australia. We work closely with Austrade to be able to facilitate that as well. And I am actually coming over to Europe later on this year and visiting a number of different countries to be able to also talk around, that pipeline. So just broadly across, we are 4 colleges at RMIT, and the Digital Health Hub, as you'll hear, sits across all 4 colleges. So what that means is we're able to build our ecosystem and our partnerships so that they don't just focus on one particular area, but they actually grow broadly across all areas of digital health. We have real strengths within our research and innovation space, as well as our training and workforce capacity. And this is, again, as I said, you can come back and have a look at all of our research areas. But what I really want to focus on is our industry engagement. RMIT is one of the leading universities in Australia for industry engagement. And in fact, one of our strong research funding schemes here in Australia that's based around industry engagement, RMIT performs at the 3rd strongest in Australia for cooperative research centre funding. What is really important as part of that industry engagement is partnerships across a broad range of areas, including research, but also workforce capabilities, being able to have internships and student projects, and being able to make sure that we can bring all of our facilities as well for our industry partners to be able to use. So, for example, we have the advanced manufacturing precinct that you can see on the slide. We're also developing a prototyping precinct where our industry partners can come and use that precinct to be able to develop prototypes. And then living laboratories where we can then test these prototypes within that safe, controlled environment. The reason why we believe it's a good model to have these living laboratories close with our health partners is that it allows our health partners direct access to them, but also our students to be able to access, real world technologies and be able to see them in a simulated health type environment. And as I said, we also have a number of international centres. So the Digital Health Hub is the one that I want to focus on for the rest of this presentation, as well as talking about the broader health ecosystem. So the RMIT Digital Health Hub is a hub, as I said, that goes right the way across the university. It's a one-stop shop, front door to the university and through to our ecosystem for anything to do with digital health. It allows us to be able to bring to our partnerships not just one area of expertise, but being able to bring together these multidisciplinary teams to be able to work together on these real-world problems. So a partner may come asking for some expertise in, for example, artificial intelligence, and we're instead able to bring to them a partnership that includes AI, but it might also include other areas such as design or health economics and health evaluation. It is the vision for our hub to be able to build this collaborative ecosystem, and that includes across multiple universities, our industry partners, so our small and medium enterprises and our multinational partners, government, and most importantly, our health partners. So that's what our model is based upon. We also do workforce capability development, and that's why the Skills for Health is such a natural fit with RMIT. So we work very closely across the ecosystem to be able to uplift the digital health skills of our health workforce through a number of different ways. So I'm not going to play the video for you, but at the end of this presentation, there's the link to the Digital Health Hub webpage, and there's a video on there that we're really proud of that shows the different areas of digital health across RMIT, but I just wanted to highlight some of our facilities that we have. So we have what's called our simulated hospital and health building. It's a 9-floor building. It includes a 52-bed simulated hospital with including 4 high-fidelity beds and an integrated electronic health record. So it's the only one of its kind in a university in Australia. What it allows is our students to be able to go in, practice some interprofessional training, so multiple disciplines working together, and to be able to allow our students to develop those skills so that when they walk into a ward, for example, they know it becomes just second behaviour with how they walk in, how they use that space. So each of our hospital bedrooms, so our wards, are designed to replicate what happens in the real world. So they know exactly where to go for the resources or for the Schedule 8 drug cabinet, or to be able to, access the computer on wheels with our EHR. We also have an extensive simulated medical imaging facility, which includes X-rays and ultrasounds. We are in the future getting an MRI and CT, and they are real cameras. We just don't have the radiation elements within it, but students are able to practice using them and moving them. And then we have software programs with simulated images that are on them. The same with our radiotherapy simulation. So we have a bed and then we have a simulation of the radiation therapy machine going around them. And as you can see, we also have a nuclear medicine dispensing facility, as well as a pharmacy simulation of both a hospital pharmacy and a community pharmacy. And then our digital human bioscience facility, which has very high definition cameras that enable us to, for example, use cadavers and then overlay using artificial reality to be able to practice surgical interns to be able to practice their skills in a safe way that's stimulated within that environment. So please take a moment to have a look at the video. Excuse me. The last thing I want to talk about was more broadly the Australian ecosystem and some of the things that we do in digital health in Australia. So just to give a representation of the size of Australia, I found this image on the left. Sorry, I'm just going to take a drink. So Australia is very, very large, but the population is extremely small. I think it's about 26 million in total. But what it means is when we talk about digital health, we really need to focus on equity of access. You can see if we take where Ireland and all across the United Kingdom is, a lot of that is land that has no populations or great distance between properties. I've just come from a panel where I've just been talking for the last hour. So I'm losing my voice now. And so when we talk about technology, we need to make sure that we are using technology in a way that can support people being able to access healthcare. And this includes not just, teleconferencing, which is the one that we always go to straight away, but also being able to have, connectivity. Quite often it's satellites to be able to, people being able to access in some really remote locations. There's no video. It's just using the radio, CB radio, to be able to access healthcare. Australia is divided into multiple states. And we do have Tasmania, which is the little island off the bottom. Many maps seem to drop off Tasmania, but it does exist, and I live there on my weekends. And again, it's unique in terms of geographical isolation for access to healthcare. We also have the Australian Digital Health Agency. This is an agency that's been established by the Australian government to be able to provide, initially it was established for digital health standards, but now it has a broader remit to be able to provide that governance and also strategy for digital health across Australia. Because we are a federated system with states, it means that how we're set up is funded very differently to what you see elsewhere, where federal government funding, so funding for all of Australia, is just provided across primary healthcare, pharmacy, etc. But hospitals are funded at a state level and looked after and managed by a state level. And so this creates a real problem for connecting our acute services with our primary care services, and then you've got aged care and mental care, health, etc. as well. So that means then the sharing of information between these can be really challenging, and that's something that our Australian Digital Health Agency are trying to tackle. They do this through a number of ways. One is their My Health Record, and I'll come back to that in a minute. But two other focus areas, number one, telehealth, and obviously that's been a focus for many countries because of COVID, but electronic prescribing and actually rolling out standards on electronic prescribing across Australia, being supported by, the technology has been another really important strategy. And this includes having standardised medication charts, for example. We have, some advances on product disclosure information for our citizens, but tied with each of these is also a literacy piece. So trying to make sure that all of our citizens have some form of digital health literacy as well as health literacy, and trying to improve those levels. The last one is the My Health Record. So this isn't a national electronic health record. It's sometimes confused with that. What this is a national personally controlled health record, and it's just a summary. So it includes a summary about the person, and then it may include pharmaceuticals, immunizations, any sort of diagnostics, so imaging and pathology. It really does depend on if that's been uploaded to the My Health record, if the provider is participating, and then whether the person has actually set up with their general practitioner the health summary. In principle, if everything's set up well and it's working well, it means that someone can go to a hospital in the far north of Western Australia, so in our Pilbara region, on a holiday from Melbourne, and an emergency department doctor can immediately see what their allergies are and what their current prescriptions are and what their health status is. It's got a long way to be developed, but certainly in Australia it started with a national health identifier, and now we have the national health record, and it will just grow from here. So there is a video if you'd like to have a look later on about the My Health record if you want further information. The last thing that I do want to touch on, using my cheeky time with the microphone still on, is to talk about some Horizon calls that are due later on this year as stage 2 calls. So we are partnering with University of Plymouth, so Samantha Prime is on the call as well. Hi, Samantha. And we are looking at participation in these types of calls for a specific reason. So in Australia, we are funded, our research is funded under the National Health and Medical Research Council, NHMRC. As I said before, because we have our European hub in Barcelona, it means that we can participate in Horizon calls, all Horizon calls, not just these ones. What typically happens is by participating, it funds our research staff within our Barcelona office, and then the Melbourne staff will also work on those projects in kind, so unfunded. With these particular calls that are on the screen, our NHMRC will also provide 500,000 Australian dollars for up to 3 years for Australian researchers to participate. Okay. So I will shortly post into the chat box a link if anyone is looking at participating in any of these calls or any other calls, and in the area that relates to digital health, and you are looking for partners, RMIT is always open to partners, and specifically the top 3 if you're interested in becoming part of a consortium. As I said, Samantha and I are interested in having a chat with anyone that is interested. That was my sneaky side bit, but there is also a link. As I said, happy for these slides to be shared. And thank you for the time.